from WhatsApp family groups there on, and that what everybody has been talking about, to even non-stop global media coverage. The one question now on everyone's mind is, do you need a booster dose of the COVID vaccine? And I have those answers ready for you. First, my colleague Milan Sharma will help you understand what precisely is the status and do you need at all a COVID booster dose, which is the third dose of the vaccine.
Do I need a COVID booster shot? Are my 2 COVID shots sufficient? Why so much chatter over a third shot? Where can I get some clear answers? On India Today, we cut through the clutter as always to answer your questions straight. Now, you had your first vaccine shot. Then, like a good responsible citizen, you lined up for your second shot. You've spent months in anxiety, hoping the 2 shots have firewalled you against the coronavirus and the so far proverbial third wave. But now you've been picking up buzz about the possibility that you'll need a booster shot of the vaccine just to keep your defenses against the virus in tip-top shape. First things first, don't worry and don't panic. But before we break it down for you, here's a clear answer from India's vaccine panel chief, dismissing the need for boosters at this time.
We do not really have true data that says that after a certain period of time, there's a need for a booster. Do we know for sure when to give the booster vaccine? We don't have a pakka answer.
The idea of a booster dose of COVID vaccine springs from several studies that prove that vaccine immunity begins to drop after 6 to 8 months of the second dose. Several countries have already recommended booster shots to their citizens. While Israel became the first one to begin boosters, they initially gave it to 60 years and above. Now also opened the third shot to 12 years and above. In the USA, all above 18 are eligible for booster doses. The UK is giving it to those above 50. Canada just authorized it for all adults. France keeps boosters for 65 years and above, while Spain and Sweden have administered boosters for those above 70 to 80 years. But even as vaccine surplus nations are recommending and administering booster shots, the debate over the need for a booster dose has the global medical fraternity divided. For starters, the World Health Organization has this to say.
Countries with the highest vaccine coverage continue to stockpile more vaccines, while low-income countries continue to wait. Every day, there are 6 times more boosters administered globally than primary doses in low-income countries. This is a scandal that must stop now.
But the Strategic Advisory Group of Experts on Immunization, or the SAGE committee, says that only people with weaker immune systems should receive an additional shot of approved COVID-19 vaccines, as they are at a high risk of severe COVID disease. In India too, experts remain divided over whether booster shots will be necessary for those beyond the most vulnerable.
It is true that for a limited amount of time, boosters will increase the antibody levels, but as far as protection from severe disease goes, 2 doses of vaccine is all that an individual needs.
Even though India has administered 1.2 billion doses, there are at least 170 million citizens who haven't got even a single dose. As far as boosters go, there's no hard evidence that boosters will further increase protection against death. It is true that for a limited amount of time, boosters will increase the antibody levels, but as far as protection from severe disease goes, there is general consensus that 2 doses are sufficient. Experts agree, however, that if boosters are ever required, it's unlikely to be recommended for anyone other than those above 65.
There was a reduction of protection against the COVID infection after 2 doses, after 5 months after the second dose of vaccination. 2 weeks after the booster dose, this protection shot up to 93 to 94% for both these cases, thereby indicating that boosters definitely boost up the protection.
The bottom line, India's top vaccine agencies and officers concur that a booster dose isn't on the table for Indians yet, but that it's being studied. The overwhelming priority is to get all eligible persons to be double vaxxed first, and that unfulfilled number is still enormous, running into hundreds of millions.
Questions are being raised because studies suggest that the vaccine immunity starts dropping after 5 to 6 months of the second dose. Whether India's decision is slow at this point, when we are at a better stage in the pandemic, cases are contained to a large extent, and India is also vaccine surplus. Meanwhile, in Europe, the situation is worsening, where the Delta variant is tearing through populations that are resisting vaccinations. Questions like whether healthcare workers and frontline workers, along with those who are above 60 years of age, qualify for a booster, but the government of India prefers to call it the third dose for an added layer of protection. With Sanjeev Kumar in New Delhi, this is Milan Sharma for India Today.
2 vaccines were cleared for pediatric use with regard to COVID-19, but there was lack of clarity, specifically with vaccinating children who have underlying health conditions. That became a roadblock, and therefore India has been right now away from vaccinating children. But a key meeting of government's National Technical Advisory Group will be held likely this month in November, and that will discuss on what is the plan to vaccinate children to protect them from COVID-19. Here's a report on that.
Surplus of 31 crore COVID vaccine doses. Exports of both Covaxin and Covishield now allowed. 2 vaccines cleared for pediatric use. So what is stopping India from vaccinating its children? A decision was taken in principle to first vaccinate children with underlying healthcare conditions. Then came the stumbling block, a lack of clarity on who these comorbid kids would be and what would be the process to vaccinate them. The government's National Technical Advisory Group is now going to meet towards the end of November to firm up a policy for vaccinating kids. Top government sources analyzing the risk-benefit ratios say that India will have a guarded approach towards vaccinations for kids, given that none of the vaccines have a regular approval and both Zydus Cadila Zycov-D and Covaxin have approvals for emergency use. Children do not fall seriously ill, and if the rollout takes a while, so be it. The good news is that ICMR's own survey shows high seroprevalence in kids, which means they have had some amount of natural immunity.
Going to school is conditional to teachers having the vaccine, staff having the vaccine, and following the SOPs in the classroom as well. And also having parents that are protected. So please, let's focus on that in a concerted way. There are stages when there is priority A, and then we move on to other priorities. Clearly at this moment, even in the interest of children, the universal vaccination of adults is critical.
But worried parents want their children vaccinated before sending them to school. Some experts back these parents.
We have seen since early 2020, the initial incidence of COVID in children was just 3%, rose to 9% by end of last year, 2020, and then 22% by early part this year, and now CDC data shows it's 25% of the overall incidence of COVID is in pediatrics. MISC, the multi-inflammatory syndrome in children, was 0.1% earlier, and now it's 1%. So obviously the incidence in children is rising, and so are the multi-organ involvements of COVID.
Meanwhile, there are some parents, of course, who are willing to take the risk.
Trial sizes are ridiculously small, and so we still don't know whether these vaccines could have long-term effects on our kids. Some people say that vaccinating kids will protect the adults surrounding them, but everything is open. Everything else is open, except for schools. So it makes no sense. For my child, the costs of this 600 plus day school closure are really stacking up.
Covaxin's dose for kids above the age of 2 has been approved by the expert panel, but is yet to get the green signal from India's regulator.
Children vaccine is, we have done complete all our clinical trial. It is with the government. Government has to take a decision, not us. And coming to the nasal, we completed a phase 2 trial now, and I think we are compiling the data. And data seems to be extremely good. And now we need to see how to go about it.
The other vaccine, Zydus Cadila Zycov-D, has been certified for those between the age of 12 to 18. In New Delhi, Sneha Mordani for India Today.
After months of delay and also so much criticism, Covaxin has finally got global recognition. The CEO of Bharat Biotech, Dr. Krishna Ella, spoke to India Today's Sneha Murdani on the WHO's approval to the Covaxin, the politics around it, and its vaccination for children as well. Listen into this exclusive conversation.
Do tell us how difficult this entire period has been and how do you look at this approval?
I mean, it is a difficult because that you have to do it everything in 10, 12, 11 months was the toughest challenge. When we have done the WHO pre-qualification before, but doing it in 10, 11 months was a Herculean task. And I think we want to thank everyone, particularly NIV, ICMR, and WHO, and our government of India. Everybody, I think everybody was good intentions are good to do something to the society. I think the public health is won the game.
You know, Dr. Ella, you did say something that I remember just a while ago that, there is a sense in India that whatever is made in India is not good. If Pfizer makes a vaccine, maybe it's good, but what we make in India may actually not be up to the mark. Did that thought stay with you throughout this entire period of developing the vaccine, and were you demotivated at any point?
I was not demotivated, but if you produce a good science, good publication to authenticate that we are not inferior to any of the multinationals in the world, I think people will accept. Today, Covaxin is a better accepted as a product, not only in India and other part of the world. And none other than Francis Collins, who is the NIH director, is acknowledging the Covaxin. And I think that's a good credibility for India. And I think we are thankful for all these things.
How perturbed were you when there was a lot of conversation about this being, a political vaccine, a BJP vaccine, a lot of things were said. Did it upset you?
It does affect, it does hurt, because we are not political people. We are only, our party is science. We breathe science. We want to do science. Nothing else we know it. But somebody says somebody doesn't like somebody and relate that one to us, that hurts. And I think science has to be neutral. We are not belong to political party or journalism or anything. We are neutral. So we want to do the best science. I think it does hurt. But for us, we have to look at the long run, what has to achieve for the country. That's how we looked at it.
My last question to you, sir, is about this tension that you had all throughout. Given that it's a BSL-3 facility, you're working with a live virus, you did say that one mistake would cost us dear. Just do tell our viewers what could have happened had anything gone wrong, and what was the kind of pressure that you were facing all throughout?
See, we were working when there is no vaccine, and we're working in a BSL-3 containment. My employees are working, and they go visit their family, and if somebody get contaminated in the premise, and they carry it to the family, and that spreads to the city, is the most disaster for us. And that was a really concern for us. Our employees' safety is the most pivotal important. And that is what we have given all the importance to them. Because every dress they wear, each one dress is a 5 lakhs rupees. One dress. And with oxygen meter. And so that was we have given every importance to the people's protection. People who are working in the plant. That was important for us. And then we want to thank the volunteers, because usually clinical trial is not being done in this country. Clinical research is not done. See, people do bioequivalence, injecting ampicillin and look at HPLC profile and all that. But a clinical research in a community-based trial, we have done ROTA, and this is the second one. We have done efficacy at this level. And I think I want to thank every project investigator in every hospital and every volunteer who came forward without even asking. And I'm telling you honestly, I paid only 750 rupees. Even the rich man to poor man, everybody is 750 rupees for their auto, according to ethical committee guidelines. Okay? And every volunteer, there was too many volunteers for the work. I think that was shown that the country can do research in this country.
So last question again, sorry. I want to know what's the road ahead. We are waiting for the final approval from the regulator for Covaxin for children, and also the nasal vaccine, which is going to be you're looking at it as a booster. What's the update on that?
I mean, children vaccine we have done complete all our clinical trial. It is with the government. Government has to take a decision, not us. And coming to the nasal, we completed a phase 2 trial now, and I think we are compiling the data, and data seems to be extremely good. And now we need to see how to go about it.
So that is a wrap on our special telecast. Remember, the COVID pandemic is still around us. Stay vaccinated, take care of yourself, and stay healthy as well. Thank you for watching. Take care. indiatoday.in, where you can get all the latest.